Global Genomic Medicine Collaborative educational webinar. We do these about once a month, and we may actually start trying to do more than one a month because we do have a lot of speakers that would like to give you a talk about the research that they're doing and the initiatives they're working on. But it gives me great pleasure today to introduce to you Dr. Lyndon Mittenall, who's a senior director at the Regeneron Genetics Center at Regeneron Pharmaceuticals in Tarrytown, New York. There he works with cross-functional teams to support the building of research collaborations and initiatives regarding human genetics. Lyndon began his work in the pharmaceutical industry at Merck, where he was in the Department of Inflammation Research studying HIV pathogenesis, and later in the Division of Cardiovascular Diseases, where he studied lipid metabolism, arteriosclerosis, and thrombotic disease. Later, Lyndon moved to the research program management at the Regeneron and helped to establish the creation of the Regeneron Genetics Center, a fully integrated human genetics center collaborating with more than 100 organizations around the world. In addition to managing genetics research, he became the technologies and platform operations team lead, managing all of Regeneron's large external therapeutic discovery collaborations. Recently, Lyndon refocused his efforts specifically on human genetics opportunities, and he now leads new research initiatives at the Regeneron Genetics Center. And today he will speak about one of those new research programs, the Together for Change Initiative, a public-private partnership expanding genomics research. Lyndon, welcome.
Great. Thank you so much for that wonderful introduction, Scott. And thank you all for joining today. Good day to everyone. And I want to thank GGMC for having these educational webinars, one, but two, for inviting me to tell you today about the Together for Change initiative. And I'm a messenger today. So I represent a lot of groups that have put this initiative together and that are partnering and supporting and really bringing this initiative to life. So I'm speaking on behalf of a lot of folks. So I do work at Regeneron, at the Regeneron Genetics Center, where we apply large-scale, fully human genetics research to advance our science and development of new medications for unmet medical needs. So we use human genetics for indication discovery, as well as target discovery, and for precision medicine opportunities. I'm not going to speak in depth on this, but really just to give you a breadth of what we do at the RGC. As Scott mentioned, we have over 130 different collaborations with different academic and healthcare groups across the world. And, we would love to speak with folks that may be online here today about collaborations with the Regeneron Genetics Center. As you can see, we work in over 20 plus countries with our collaborators. And those countries in blue are ones that we have active collaborations, and those in green are ones that we're working towards. Would love to speak with others about other opportunities to collaborate with you on research. With our collaborators, we've done a lot. We've made a lot of, created a lot of sequence data. There's about 2.5 million people that we've sequenced to date. And a lot of those are in underrepresented genetic research studies. And again, as I mentioned, we use genetics to help drive our target discovery pipeline. And we've identified many targets using human genetics and have started many different therapeutic programs based on this human genetic information. So we think we are continuing to do good science using human genetics. And we also try to look for opportunities to do science for good. So we want to do good science, continue to do good science, but we want to also try and do science for good. And that's really what this Together for Change initiative is about. So I'd like to just briefly tell you sort of how this happened. So, I'm a graduate of a historically Black college, university, HBCU, in Columbia, South Carolina, where I grew up. I went to Benedict College. I was a part of two federally funded programs, the MBRS and MARC programs. And these programs really gave me my first exposure to research in the laboratory. Because of those programs, I was offered to go to different summer internships And those summer internships, I did three: Roswell, Argonne, and Merck. And by the way, that's academic, government, and pharmaceutical, which, when I did it, I didn't plan it that way. But when I look back on my career, those are the three areas that, scientists and biological sciences would go into. But that allowed me to expand my exposure to research, but also to build those key professional relationships that are so important in your career, in our career. Because I left Benedict, graduated Benedict chemistry degree, went to graduate school at Penn State, got my PhD in biological chemistry, enzyme kinetics, and then I went to St. Jude and did a postdoc in influenza virus pathogenesis. But during that time, I kept in contact with those relationships that I built. And that was very, very key to my career. So because I built a very close relationship with those mentors that I had, and specifically Hollis Williams at Merck, that got me to get into the pharmaceutical industry as my first job. And that was a job that I got in the Division of Inflammation Research, as Scott said, at Merck. And while at Merck doing research there, I also was able to be involved with other initiatives and was able to see how initiatives were important for, nurturing careers, new scientists. We don't know where the next Einstein's going to be, right? So we want to nurture those young scientists and inspire them to go into science careers. So I was a part of the UNCF Merck Science Initiative, mentored a lot of students in those programs, and actually recruited some of those programs over to Regeneron when I recruited some of those students over to Regeneron when I came over to Regeneron. So I came over to Regeneron, helped establish the Regeneron Genetics Center here some 11 years ago now. And as Scott said, I helped to set up now these collaborations that we're working on with different organizations. 2020 happened. We all know what happened around the world. We had COVID. We saw health disparities play out on TV, if you will. We also saw the murder of George Floyd. We had the Black Lives Matter movement. And a lot of organizations were looking for opportunities to do something that was impactful to not only the Black community, but to a lot of minority communities around the world. So, Regeneron's no different. We were trying to look for what we could do to make a difference. So I thought about how I got here. How did Lyndon get to Regeneron? So that's why I mapped out my career path here and said, what were those key inflection points that allowed me to make decisions to really move the needle in my professional career? Secondly, I looked at what does Regeneron have in its toolbox that can really make a difference. We have a genetics center. As I showed you, we have a sequence capacity that, not a lot of folks have. So I went to my senior leadership and said, hey, why don't we partner with our HBCUs and institutions in Africa and other places and provide them financial support, provide their students this key exposure and mentorship and inspiration and guidance that's needed, like it was for me with the MBRS program. Provide them the opportunity to build those key professional relationships like it was for me with those internships. Build equity and build on the workforce in these communities and advance science and health in a community that's understudied. And we didn't have to do this in isolation, I said. We can do this collectively like we've done before with other types of initiatives like the UK Biobank, where we brought different companies together to sequence that cohort and to provide that data to the public. So the senior leadership here at Regeneron loved it. They said, hey, let me go out and develop that. And that's what really sparked the Together for Change initiative. This is a 10-year commitment to support community science and health. It has many organizations that are a part of this, and I'm so proud to say that we have partners like AstraZeneca, Novo Nordisk, and Roche Genentech to be a part of us and help shape this whole initiative. Secondly, I'm just thrilled to have Our foundational HBCU partner, Meharry Medical College out of Nashville, Tennessee, Dr. James Hildreth, their president and CEO, Anil Shankar there, their senior vice president of research innovations, worked with us to develop this initiative over 3 years. So this is not something that just came about. This was very meticulously thought about and planned alongside our HBCU foundational partner, Meharry, and all of the organizations listed here. Last thing I would say here on this slide is that we've started a new nonprofit organization called the Diaspora Human Genomics Institute. This institute is a 501c3 nonprofit that is managing all of the Together for Change initiative here. So what are we trying to change? We're trying to change healthcare for everyone, for all people. And we're going to put a focus with this initiative on people of African ancestry for many reasons. And this is an international initiative that has two components, a genomics study initiative, so it's genomics, and equity. And there is a grant component. So there's a genetic study and there's a grant component to build, inspire students, mentor students, inspire them, help build capacity at their institutions, and support them throughout their journey in their educational career path. We're trying to address two main systemic problems that we see. One, diversity in STEM careers continue to be underrepresented by a lot of different minority groups. Here I'm showing, about 9% of the STEM careers are held by African Americans, with about 5% being in the life sciences. And this is closely tied to their educational system. And this is backed up by a recent study that showed in 2021 that we need concrete steps to diversify the scientific workforce. And this graph here, you can see that when you look at the different minority groups listed here, one, all of them are underrepresented in STEM, but two, their progression, their proportion declines as they progress from undergraduate to graduate to faculty. So instead of having an inclination, they actually decline over time throughout their career. So we need more inspiration. We need more support of these scientists so that they can participate in research and STEM professions. Secondly, when you look specifically at genetics, since we're talking genetics here, when we did a quick sort of survey of PubMed and said how many papers were published between 2011 and 2022, there's about, on genetics research, there's about 30,000 publications published, and about 4% of those publications involved people of African ancestry. But when you look at the historically Black medical schools, Howard, Morehouse, Charles Drew, and Meharry, you see a lower proportion of overall papers. But of the papers that were published by those historically Black medical schools, 50% of those papers actually involve people of African ancestry. So this means that researchers, depending on where you are and when your background, they have a personal connection to their ancestry and country of origin. And they will put more emphasis on studying those populations because they are part of those communities. The second systemic problem we're trying to solve here is genetics is not inclusive, and we all know this. This publication from 2019 shows about 2% of the genetic information we're studying today comes from people of African ancestry, and this number is actually lower because since this time of 2019, it's about, I think, 1% now of the genetic information we're studying. And this creates a health gap, a healthcare gap. And folks that are on this chart in the different colors here are not benefiting from preventative and precision medicine, for example. So we want to solve that. And there's many opportunities for this because we see that, people of African ancestry, there's a lot of variation in the genetic information when you look at their structural analysis here. And across Africa, the different regions in Africa, there's a lot of diversity, as well as African Americans here in the United States. So we're missing this opportunity because with that genetic variation, with more variants, you can have more discoveries. And this is played out many times in publications where discoveries were made in when people include people of African ancestry into their genetic studies. And there's just some examples listed here. But we can also improve on the genomic tools that we're using when we study different diverse populations. From the UK Biobank data, folks have shown that we really need better tools for predicting disease risk using polygenic risk scores. This shows one graph just showing that when you look at in the UK Biobank and you build your algorithms on people of European ancestry, because it's mostly European ancestry in the UK Biobank cohort, when you then apply those algorithms to disease risk for people of African ancestry in this example, you see that the accuracy of that prediction is about 25%. So we need more diversity. We need more large-scale data sets to help improve on these tools that we're using. And then last, I'll just say that studying people from different populations and specifically people of African ancestry, we can actually make actionable, make some actions that can really help their healthcare now. This is just showing a publication from looking at cardiovascular disease genes. And you can see that in medically actionable genes, there are more variants of unknown significance in people of African ancestry. So if we had larger populations to study of African ancestry that's linked to phenotype data and so forth, we'll be able to understand what these variants are doing, and therefore we can validate some of these clinically actionable variants in these different populations. So how are we going to close this gap? We're going to close this gap by accelerating educational pathways, build more diversity in the genetics research that we're doing, and improve on the genomic tools that we're using for people of African ancestry. And we're going to do this through our unique public-private partnership and build a collaboration ecosystem that will be driven by the Diaspora Human Genomics Institute. We are again proud that Meharry Medical College chartered the Diaspora Human Genomics Institute and is again our foundational HBCU partner here to help us in this initiative. But we're inviting all HBCUs to join us in this effort. And we're asking even all of you to join us in this effort. You don't have to be an HBCU. You don't have to be a minority serving institution to be a part of this initiative. We're inviting, as I mentioned, this is an international initiative. So we're inviting a lot of our colleagues in Africa to join us. Again, those of you online, if you have interest, let's follow up. But we're looking for folks and organizations in Africa, as well as the Caribbean and South America, to join us in this effort. We need our majority institutions, especially those here in the US, to join us. There's large populations of African Americans in different American cities here, and they will be participating in not only recruitment for this genomic study, but also in training and sharing information that they know with our different colleagues. And we believe that pharma has to be a part of the solution here, not only in terms of putting money into this initiative, but it's the know-how. As I mentioned, we do genetics research here for a lot of target identification and validation work, but also to just advance science and biology as we learn more about our human biology. So we hope this also this list of companies also grow. And again, I'm just so proud of my colleagues at AZ, Roche, and Novo for being a part of this initiative. And again, I speak on behalf of all of this group here, Meharry, the DHGI, and these companies listed here. And we're going to be doing a lot together. So there's room for everyone to be a part of this. And that's why this initiative is called Together for Change, because we do bring different talents to the table here. So don't feel that if you don't hear something today that you can't be a part of this, please reach out. I am sure there's an opportunity for your organization or you to be a part of this. We're going to be doing things like community engagement, having collaborative projects together. And it doesn't have to necessarily be on genetics. It could be other opportunities as well. And doing these projects together can lead to multi-institutional funding, especially to the schools who need it, like our HBCUs and institutions in Africa. There's going to be a lot of mentorship and training. And that's why I said, your career path, your professional connections are important here and can help with this initiative. And your know-how. There's a lot of, like I said, majority institutions who are doing really good genetics research, and they can share their knowledge on how they do that with these different schools. There's lots of opportunities for professional development and career opportunities because you got corporate biopharma, you got academic, you got international academic and healthcare organizations, our HBCUs. So there's a lot of opportunity for professional growth and career opportunities for students that are in your institution and elsewhere. We have 5 main goals in this initiative. We want to first start by empowering communities. We want to empower them with information on health and medical research. Because here in the United States, for example, we do need to talk about genetics and how genetics affects your health. And we're going to do that through listening sessions first. We want to pose the question to folks and see how they feel about this initiative and to hear them and hear their concerns. We want to put on health events where we can then address those concerns through specific, topics that they brought up and to tell them, how this helps their health or their community or the population at whole. And we're planning our first health summit now for Nashville at Meharry Medical College. We also want to deepen community STEM education. Again, we want to inspire students early to go into STEM and then support them throughout their career. We're doing this to a national science fund for elementary, middle, and high schools throughout the nation, as well as we're building or supporting a DNA learning center at Meharry where students can come on site and do hands-on experiments and learn about DNA and genetics. We have a high school lab internship program, and we have an undergraduate internship program. Again, going from K to 12 into that undergraduate space and beyond. We want to expand on the genetic counseling workforce by establishing the first joint HBCU genetic counseling training program. Of the 107 HBCUs here in the United States, none of them currently have a genetics counseling training program. Xavier University in Louisiana is about to start one, so this will be probably the second. It depends on how fast we get ours. And we want to create the first medical genetics fellowship program at a historically Black medical school. There's 4 Black medical schools here in the US, and none of them have a medical genetics fellowship program. And we want to increase African researchers doing genetics. And we're going to do this by creating this database, and then we're going to share that database exclusively with these DHGI membered institutions. These membered institutions can share the data with who they want to collaborate with. So we give them the agency to select who they want to share it with versus making it a public database where, larger institutions will get access to it and then study it and publish and get all of the grants. Here, we're trying to give it, we will give it exclusively to these membered institutions. They can select who they want to share the data with through collaborative research, which again will hopefully bring in funding for not only the majority institution, but also for the HBCU or membered institution. We're going to provide the database, but also provide guidance on how to analyze large-scale genetics data. So we're going to do this through things like we're doing today through webinars. And, you know, I really admire GGMC's webinar series because I do see value in how this can reach so many different places and researchers around the world. So we want to do that. We want to provide specific workshops and webinars on how to analyze large data sets to our DHGI membered institutions. And last, we want to create that database. We want to build these community partnerships. That's so key. And through that empowerment of information, and then sequence 500,000 people of African ancestry as a start, and link that information to phenotype data. So, and again, providing that data set again to our researchers. We've launched this initiative just a year ago, October 18th of last year. We launched it at Meharry Medical College in Nashville. We had a cross-section of a lot of different organizations and community academics there. It was a great event. And now we're building on that energy in this first year by establishing the foundation for the Diaspora Human Genomics Institute with their board of directors, ethics committee, and hires at the Institute, setting up processes that are so important on how we're going to work and you know, the key steps that we need to do. And now we're in a phase where now we're starting to contact different organizations to join us, and not only in their recruitment of participants for the sequencing study, but also for other opportunities of training and mentoring and helping with whatever the partner can bring in. And this is something that's not pushed upon our community here, our Black community. This is actually something that the Black community is asking for. So we really wanted to ask that question, you know, are we proposing something here that people don't want and we're going to push this on them? Or is this something that they really want? So we did a quick artificial intelligence machine learning experiment online, and we looked at over time about 650,000 digital discussions being had online about genomics research and genetic testing. There were about 650 1,000 discussions. About 50,000 of those discussions came from people who self-identified as Black Americans. So this is very US-centric here. This is the summary of the data from those 50,000 Black Americans. So you can see here on the left, there's about 20% of Black Americans who had a positive view of genomics research and genetic testing. This is down 1.5-fold from the 650,000 total. When you look on the right in red, you see about 30% of Black Americans had a negative view of genomics research and genetic testing. And this is up about 1.7-fold from the average of the 650,000. A lot of this negativity was, you know, around confusion, misinformation, cost. They didn't understand the cost. They didn't trust their healthcare provider, and they really didn't know how genetics research works. And you can see the numbers here. You know, they're up from the average of the 650,000. When you look in the middle here, it's interesting. There's 50% of Black Americans went online to understand what genetics research and genetic testing are and how that helps how does it help them? So again, this is something that Black Americans are asking to learn more about. And that's why this initiative, I think, is very timely, because we can have those community empowerment and education and just discussions with the community about genetics and how it affects your health and why participation is so important. So there's power in numbers. We need everyone to participate. We would love for you to participate. There's many ways to participate. And, just thinking about the genetic study, Meharry will be doing some recruitment from their Nashville area, from their hospital systems. We've been talking with a lot of folks in Africa across the continent about this initiative, and we hope that they also participate. And we've been talking to a lot of US, like I said, majority institutions. And I should say that the majority of this 500,000 cohort will come from the US. It will not be a purely, going east to Africa and getting the genetic information and coming back west, where it's the majority of the information is actually going to be sequenced in the West, in the US. And we're willing to provide all of this data to DHGI membered institutions, both here in the US as well as in Africa and across the globe. I'm also proud to say that the Regeneron Genetics Center is providing all of this genetic sequencing in kind. So we're going to do 500,000 whole exome sequencing, as well as genotype by sequencing of all 500,000 participants, and at least 50,000 whole genomes, and use that information to build better imputation tools so we can impute on the genomes that we have in this database. All of this information will be linked to curated and harmonized phenotype data. So we're going to have phenotype data coming from the different organizations that are participating here. There's funding in this initiative for an organization to then curate and harmonize that data. The DHGI will manage, and so that the phenotype data is analysis ready. So it's not like you have to figure out the phenotype data and convert and harmonize the data across the different cohorts. It's all going to be harmonized so that you have the genotype data and the harmonized curated phenotype data, and it's ready for analysis. So you can join us in many ways. I just list two here. You can join as a collaborator, and you get in-kind sequencing of your cohort. If you have a cohort that you want to put into T4C, you can get in-kind sequencing. And also you'll have the opportunity to collaborate on the full 500,000 participant data set by being a collaborator. You can also join as a DHGI member, and here you'll be able to do research collaborations with different organizations within the DHGI on the full data set, and you get access to mentoring and research and training opportunities for your students and faculty at your organization. And again, I know there might be some technology groups in here today, so there's opportunities there where we can work together to help build platforms to help with schools and the analysis of the data and things like that. So there's lots of opportunities. I just wanted to highlight these two. So we really think this unique public-private partnership with these different organizations, and hopefully the list will grow, will really make an impact here on at least this population of genetics. There's a lot of activities we'll be doing together, as I mentioned earlier, and I'm sure there's room for all of us to participate in this initiative. And again, I know I focused, and this initiative is focused on people of African ancestry. There's a lot of colors on these pie charts here that need addressing. All right. When I say diversity in STEM careers continues to be underrepresented, it's underrepresented for a lot of groups. Genetics is not currently inclusive for a lot of groups. I'm hoping, and we're hoping, all of us in the Together for Change initiative is hoping that this initiative could be a catalytic model for other underrepresented groups that are listed here. But we have to start somewhere, and we wanted to start with people of African ancestry. And hopefully, you know, when we're successful, we can then copy and paste this and do this for a lot of other groups. So my take-home message is everyone should continue to do your good science, but also look for those opportunities to do science for good. So I want to, on behalf of all of these organizations, the DHGI, Meharry, AstraZeneca, Novo Nordisk, and Roche Genentech, I just want to say thank you all for being a part of this initiative. And I want to thank you for listening. And, you know, we haven't figured all of this out. So if you have ideas, if you see gaps that, you know, we should consider, please let us know. We are open. This is a 10-year initiative, and we are committed to ensuring that this is successful. Thank you.
Thank you, Lyndon. That was an outstanding presentation on, I think, as you said, an initiative that's centered around African genetics, but is a great model for underrepresented genetic populations around the globe moving forward and creating a graph that all those colors look much more equal in terms of representation than the preponderance of European. This presentation is open for questions. You can type them in the chat or raise your hand and ask a question. Jeff, you've got your hand up. Please ask away.
Hey, thank you. Thanks, Lyndon. That was great to hear again about this. I've heard you talk about this a couple of times before, but it keeps getting better. And for one thing, I would like to at least have a conversation with you about how the All of Us research program can work more closely with the Diaspora Human Genomics Institute. We have a lot of common goals, I feel, in terms of the underrepresented minority workforce and improving their ability to be successful. But I wanted to also just hone in on a couple of things that you're doing, and you know, maybe there certainly wasn't a lot of detail that you couldn't present today. But when I look at the success rates for underrepresented minorities achieving NIH grants, that's been a big challenge, and it hasn't really changed very much despite some efforts to do so. And I see a lot of features of Together for Change that could help this. In the mentorship arena, which you mentioned several times, it does seem like helping individuals prepare their grant proposals in a much more systematic and comprehensive way, particularly with faculty members that have had success, even though they're small in number. I think it's important for them to give back. So that's one piece I feel should be amplified in helping young investigators get their first NIH funding or funding from other organizations. I assume also that there's seed funding available so that young investigators at Meharry and other HBCUs or medical schools can get some preliminary data that will be useful for them applying for grants. And then the last thing is, I wonder, you know, one of the big features of the lack of success, I think, is the reviewer bias that exists in study sections. And I don't know, actually, I wish I knew more about how that's been changed, but it seems like you have a repository of potential reviewers in the institute and in the Together for Change initiative that could maybe volunteer to be part of review teams, review groups that would maybe change the equation on bias in the review process at NIH and other funding organizations. So I don't know if you want to respond to any of that, but I just want to congratulate you on taking this initiative, and hopefully we'll see some significant impact on the trajectory of these populations as they move through their professional careers.
Yeah, no, Jeff, you hit on a lot of points that we would love to, one, talk to you more about, because I do think all of the things you said, you know, the submission of the grants, getting the data or actually getting funding to generate some initial data to then submit the grant and getting mentorship on writing that grant. All of that process, I think, is something that could be, dealt with or assisted in Together for Change. And then the review process, or people being a part of that review process, that is something I would really love to pick your brain about more, and others about how to do that and how we can help in doing that. So great points.
For sure.
Lyndon, we have another question from Nala Fifi. Nala, would you like to ask the question, or would you like me to do it?
Yes, because now I am have a dual work. Like in Egypt, we are in Africa, but we have different backgrounds according to the region. So how it will be, we can participate. We have different biobanks or programs. So if I want to distribute this initiative, how can I do that?
Yeah, you can be a part of this initiative. Egypt is part of Africa. It's around African ancestry, but what everyone I say everyone is African because of the African diaspora, right? So where do you make your cutoff, Lyndon, and blah blah blah? I think all underrepresented groups, and Egypt is one, where we need to learn more genetics on populations in Egypt. So we'd love to have a conversation with you, Nala, about your biobanks and or ideas or folks that we should talk to there. We're already in some conversations with some folks there in Egypt, so definitely can participate.
Thank you.
Grant,
Yes, Scott, Grant has a comment also.
Grant has a question, and I would be able to ask it too. And Lyndon, that's just how can GGMC, the Global Genomic Medicine Collaborative, and its two consortia, the International Health Cohorts Consortia and the Global Genomic Medicine Consortia, participate and help you particularly in moving this program forward?
Yeah, one of the things is your webinar series here. So you've already been helpful by helping us get the word out and, socialize, if you will, this initiative, because people need to hear about it. And then, that sparks other ideas. And as I said, we probably have not figured everything out here. And that's why we did a 10-year initiative where we could, develop and evolve with time, with the different needs. GGMC and IHCC, you guys have a big membership, and of people who are already doing genetics research. So one, I would say let's talk about how we could maybe incorporate some of the studies that are already biobanked, or people who are already doing research. If you want to do a prospective study, another study, let's talk about that. And you have that membership. So let's continue to talk about that. And also, like I said, your webinar series allows folks to learn and learn how to do these types of analysis and the things that we want to share in terms of genetic analysis on this population. So we can talk about some opportunities there as well, utilizing this platform.
Okay. And maybe as a follow-up to that, for some of the funding processes that you mentioned that you're putting together, do you have any sort of a sense of a timeline as to when people, I understand everyone can join and be part of this, but how do you formally be part of that if you want it?
Yeah.
If I want to do it right now, do I reach out to Lyndon Mittenall? Do I reach out to the DHGI? Do I reach out to Meharry? Is there something in place that we can start to use?
Yeah, great question. I think we're very close to that, to having that information at our website to say, if you'd like to join, click here, and then there will be a process and so forth. I think we're very, very close to that. This year, that since October 18th, we've been, sort of trying to get everything else in place. As you know, starting a new organization it's like a new it's like a new company you're starting, right? And it's a lot of things that I didn't realize. We have to get insurance, we have to get a lot of things that just takes time. I'm glad to see my partner here, Nikia Lori, who's the Senior Director, our first hire at the Diaspora Human Genomics Institute online here. So Nikia will be that key person. So when you do that click, or when we send out an email that has the information, that information will go to Nikia, and Nikia will follow up and say, this is how you join. There's no membership fee to join. It's just, we're talking now about that membership and so forth, and what that means, because there'll be different levels of membership. So you can be a corporate sponsor, you can be a DHGI membered institution that gets access to data and stuff like that. So so Nikia would be key to that, but I think we're close, Scott, in having that information all polished up, and then we could socialize it out.
Okay, great. Any other questions from people online? You can either type that in the chat or raise your hand and ask it, or speak up. Anybody? I'm going to ask just a quick question. You mentioned that there's 4 historically Black medical schools in the U.S. So I know one of them because you talked about it today, Meharry, but what
Yeah.
are the other 3?
Yeah, it's Howard University in DC, Morehouse School of Medicine in Atlanta, and Charles Drew School of Medicine in Los Angeles.
Okay,
There's
thank you.
2 more. There's 2 more that are about to kick off. So Xavier University in Louisiana is about to start their medical school, and they're in partnership with Ochsner. And Morgan State University in Baltimore is about to establish their medical school. So,
Okay, thank you. Any other questions from anyone? I'll ask one more, and then I'll quit, Lyndon. And that's that one of our consortia, the Global Genomic Medicine Consortia, is really concentrating on clinical implementation, which is not necessarily genetic research, but taking that research and reducing it to clinical utility and actually having it affect patients. Is there space in this initiative for that sort of research, or that sort of work too,
yeah.
on gaining, getting these actual findings into the clinic and meaningful to patients?
Absolutely. I
Okay.
mean, if you sequence 500,000 people of African ancestry, and especially a lot of them being here in the US, they're going to have electronic health record information that tells the kind of medication they're taking and so forth, right?
Mhm.
Just think, with 500,000 people sequenced, you're going to be able to look at a lot of pharmacogenomics, look and see
Mhm.
what sort of variants are in this population that affects medication use, medicines you should be taking or not take. That's one. Second thing is what I touched on earlier about the variants of unknown significance. So there's a lot of variants in BRCA gene, for example, but we don't know if it's a damaging, it looks damaging, but it hasn't been validated to say this, if you carry this variant, you have cancer, for example. So we'll be doing a lot of that with so many people sequenced. By the way, I'm going to go aside here. I kind of hinted to this a little bit, but just want to go into it a little deeper. We're going to start with 500,000, and we're sequencing that first 500,000 in the first 6 years of this initiative. So 5 years from today, we're going to have 500,000 people sequenced. This is a 10-year initiative. We specifically did that because if we do get to 500,000 after the first 6 years, we're going to double down, double click onto 1 million. So I just say that because the larger the database that you have, the more of those clinical opportunities, if you will, diagnostics, right? You can make better diagnostic tools for, looking at different genetics in various genes, right? So a lot of diagnostic companies would be very interested in this data set. the variants of unknown significance, the pharmacogenomics. Those are just some examples I see. Better polygenic risk scores for predicting risk for disease. So a lot of those affect people's health right now.
But I was struck by your graph, or not your graph, the diagram where you showed people's perceptions of genetic research, particularly African Americans' perceptions. And there's a big space in the middle. You mentioned the ends of the spectrum, like it, don't like it, don't understand it. But there's that big space in the middle, and some quickly tangible wins from your program could help shift that. We talk about shifting ideas in election times, but shifting people's perceptions to, oh, you know, I heard about that. That made a difference for someone I know. It's like people's interest in different diseases. If they know someone that has that disease, for instance, if they actually know someone that benefited from this type of research, it could really help recruitment efforts, I would think.
Absolutely, absolutely, Scott. And you know, I would just add on to, I agree with everything you said, that this initiative can help with those conversations. And that's why our first goal here is to have those community empowerment and engagement events. And I would just add on that discussion is a better discussion, especially with this population, if it's from someone who looks like them and comes from their community, and that is a trusted, you know, person within the community. And so that's where I think Meharry really comes in, and Dr. Hildreth during COVID, for example, you know, they say Dr. Hildreth saved Nashville because he was talking about COVID and why people should take the vaccines and so forth, and that they trusted him. And that's why we were looking for that trusted partner who, you know, because we're a pharmaceutical company, even though I'm an African American, people see that building behind me and label me as, you know, pharma. Mm-hmm. So I wanted to have that conversation, but you know, it's better, I think, if it's someone who's already a trusted figure in the community, like Dr. Hildreth.
Okay, any other questions? Oh, here's one.
Hey, Scott, you freeze.
Yeah, I think it says what cohorts are included in this study.
Yeah,
what cohorts are included? Is it general population or population enriched in specific diseases?
Yeah, so, you know, I call it a general population study. And what we're asking our collaborators to do is to tell us what you would like to study. We're not going to say, you know, Regeneron's interested in eye disease, so can you go out and... No, it's not about us. It's about you. It's about your community. This initiative is very, very community driven and researcher driven. So, you know, I talk to folks in Africa and they say, hey, you know, what are you guys looking for? And I'm like, we're not looking for anything. We're looking to help you, empower you. And so whatever your community, whatever your healthcare system is seeing, like if you see a lot of people coming in with cancers, I think you should study that. If you have people coming in with Lassa virus, you should study that. If you see malaria, you should study that, because that, to your point earlier, Scott, that's going to really move the needle in terms of helping your community. So it's not driven by us. It's driven by our collaborators, how you see, you know, what you're seeing in your community.
Fantastic. Any other questions from anyone? Going once, going twice.
Yeah, I'm just gonna announce.
Thank you,
There's no other question.
Please make your announcement.
Yeah. Mm-hmm. Okay. First of all, thank you so much, Dr. Mitnal, for this insightful presentation. I can see that GGMC can have a good collaboration with you, especially in the area of education, training, and mentorship program. And thank you for the audience for your participation. And we are so excited to announce that we have next GGMC webinar on The title of the webinar, I put it on the chat box. It's Demystifying Skeletal Dysplasia, Learning from Patients, featuring the esteemed Dr. Vindhya Subsingh. And the webinar will take place on November 21st at 9 a.m. EST. Eastern time. So stay tuned. And not only for this webinar, we have other exciting webinar coming also in December and also in 2025. And we may have maybe 2 webinars per month as we have more guest speakers that are willing to present their research for GGMC audience. So thank you again and stay tuned for the invite for the upcoming webinar. I can see maybe there are other new messages here. Are you looking if there is anything? Okay, they just the email from Dr. Linden to contact him. Any other things? Yeah, please feel free to reach out to us. If you have any questions, please let us know. And thank you again.
Lyndon,
Thank you all.
Lyndon, thanks again, and do science for good.
There you go.
I'm going to keep that word in the top of my mind.
Yes,
Bye,
very
everyone.
nice.
Thank you for joining.
Very nice one.
Bye-bye.
Yeah, thank you and have a good day. Bye-bye.
Bye-bye.